If you're on Ozempic, Wegovy, Manjaro, or Zepbound, or you're thinking about starting one of these medications, there are 4 things I need you to understand before you go any further. Because most of people who start these medications don't know about them. And some of them will cost you in ways you won't see coming until, unfortunately, it's too late. Hi, I'm Dr. Esra Shermadou. I'm a board-certified family and obesity medicine physician, and I prescribe these medications nearly every day in my practice. These medications are fantastic and genuinely life-changing for many people, and I am not here to scare you off of them. But there's a conversation that needs to happen around these medications that almost nobody is having, and that's what this video is for. I use these medications in my practice all the time, and I've seen them help people lose significant weight, reduce inflammation, lower blood sugar, and truly change the trajectory of their life and their health in a positive way. But medication without the full picture is where things go wrong. So let's talk about the full picture. The first thing no one tells you, and this is the one that concerns me the most as a physician, is that weight loss in any way, shape, or form, whether it's through diet, surgery, medication, can cause you to lose muscle. The faster the weight loss, the greater risk of muscle loss if we don't lose weight properly. So here's what's happening. When you're in a caloric deficit, whether, again, that's from reducing your food intake, bariatric surgery, or any of these anti-obesity medications, your body doesn't only burn fat for energy. It also breaks down lean mass. And lean mass isn't just muscle. That includes your organs, your water, and other tissue. On average, about 30% of weight loss, regardless of the method, tends to come from lean mass rather than from fat. And that number can shift depending on factors like your age, your sex, and how aggressive the caloric deficit is. The more severe the deficit, the greater the lean mass loss. Now, why does that matter? Well, muscle is not just about how you look. Muscle is your metabolism. It's what keeps your blood sugar stable and prevents insulin resistance and diabetes. Muscle is what keeps you functional and independent as you age. The more muscle you lose now, the harder everything gets later. Weight management, energy, bone density, balance, longevity, all of it. And here's the problem. Most people on these medications are not doing anything to protect their muscle. They're eating less, sometimes dramatically less, and not moving in a way that signals to their body to hold on to what they have. So the weight on the scale goes down. They feel great about that. But what they don't realize is that some of what they're losing is the very tissue that was going to carry them through the next 20 years. This is not a reason to avoid GLP-1s. This is just a reason to take muscle preservation seriously from day one. And I'm going to tell you exactly what that looks like coming up. This brings me to the second thing nobody talks about. What you eat on these medications matters more than most people realize, not less. When your appetite is suppressed, it is very easy to undereat. And when I say undereat, I don't just mean undereating calories. I mean undereating your protein too. Protein is what your body uses to build and maintain muscle. And when you're eating significantly less food, protein is almost always the first thing to drop. Here's what I want you to think about. If you're on a GLP-1 and you're not intentionally prioritizing protein at every meal, you are almost certainly not getting enough. The general target I work towards with my patients is about 1 gram of protein per pound of body weight, or around per pound of your goal body weight. For most people, that number is higher than they think and harder to hit than they expect, especially when your appetite is blunted. Protein-rich foods like lean meats, eggs, Greek yogurt, cottage cheese need to be the anchor at every meal, not an afterthought. And I want to say something directly if you're on GLP-1 medicine and you're skipping your meals because you're not just hungry. I understand that. The medication does that. But skipping meals while already in a caloric deficit without prioritizing protein is one of the fastest ways to accelerate muscle loss. Eat less if the medicine is guiding you there, but intentionally eat your protein first every time, even if that means including some protein supplementation. And if you're still having trouble with protein intake, consider lowering your dose. Third, and most importantly, if you are on a GLP-1 medicine and you are not strength training, you are leaving the most important piece of this on the table. I'm not talking about walking. I'm not talking about a group fitness class. I am talking about progressive resistance training, lifting weights in a way that progressively challenges your muscles over time. This is a signal your body needs to hold on to muscle while it's losing fat. Without it, your body has no reason to preserve that tissue. It will use it for energy and you will lose it. Strength training on a GLP-1 is not optional. It is the mechanism by which this medication works the way it's supposed to, where the weight you lose is primarily fat and not the muscle that you need. I know it can seem overwhelming to start, especially when you feel like you have no energy or if you don't know what you're doing in a gym. Ideally, I would like to have my patients start on a strength training plan even before they start these medications. But this is literally the piece that makes everything else work. The medication can suppress your appetite, but it cannot tell your body what to prioritize. That's what strength training does. If you don't know where to start simple. 2 days a week and focus on compound movements like squats, deadlifts, rows, presses. Work with a trainer if you can and build that habit before you build the program. And if you're working with a physician on a GLP-1 therapy, ask them directly, what's the plan to preserve my muscle? And try to figure out a plan together to help you preserve the muscle. Fourth, and this one is for everyone who feels like their medication has stopped working or who is scared that it will. Let's talk about why GLP-1s plateau. This is one of the most common things I hear. Someone starts with Wegovy or Zepbound, loses 15, 20, sometimes 30 pounds, and then nothing. The scale stops moving. They feel like the medication isn't working anymore. They feel like they failed, but they haven't failed. But something has shifted, and it's worth understanding what. A few things happen over time on these medications, and even when losing weight without them. Your body adapts. Your metabolic rate adjusts to your new lower weight. Your body no longer needs as many calories to fuel itself. The hormonal environment changes. And critically, if you've lost muscle along the way, your metabolism has slowed because muscle is metabolically active tissue. This is exactly why the muscle conversation matters so much. People who lose muscle during GLP-1 therapy often find themselves at a lower weight, but with a slower metabolism than before, which then makes maintaining that weight harder and losing more weight nearly impossible without further restriction. There are also cases where the dose needs to be evaluated, where hormonal factors haven't been addressed, where sleep and stress are actively working against weight loss progress. These are physician-level conversations that need to happen, not just a refill every month. If you feel like your GLP-1 medication has stopped working, don't adjust the dose on your own, don't assume you failed, and don't assume the medication is the problem. Get a real conversation with a physician who can look at the full picture, your hormones, your muscle mass, your nutrition, your sleep, your stress, and actually help you figure out what's going on. That's what obesity medicine exists for. I want to close with something I say to my patients regularly. Managing your weight, preserving your muscle, figuring out what to eat, knowing what to do when the scale stops moving, adjusting as your body changes. This is a lot to carry on your own, and you shouldn't have to carry it alone. Having a physician who's actually available to you, not just at your annual physical, but when things come up, when the medication needs to be adjusted, when your nutrition needs to be recalibrated, when you need someone to look at what's actually happening, that changes everything. And at Sakina Health, I work with adults who are done trying to figure this out by themselves. We build a real plan that includes weight management with or without medication, hormone optimization, nutrition guidance, strength training, of course, as part of your care and not an afterthought. And I stay with you long term. If that sounds like what you've been looking for, I would love to talk. The link to learn more and reach out is in the description. And if this video is helpful, please share it with someone who's on one of these medications or considering and doesn't have this information yet. They need to hear it. And I'll see you in the next one.